And then, she starts right. Yeah. So what I do is I do this like now, and then I go back and
Are you doing roll call? Are you doing the land acknowledgement?
I'm doing basically all the facilitation. I won't know if I won't see eyes in the room. So you might need to say, Mark, blah, 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 has got his hand raised, or, you might need to cue me if there's something happening that I don't know, or if there is someone from the public, or if Roland's getting up, or, something that I can't see. Okay.
Keep this is on right.
When it's lit, it means it's on. Grant is very paranoid about. That you can see sometimes, they always need calls. And you see the lights on and off. This show over speaking. I will pick up the slides that I record slides. Maybe shadow.
Come to order for, and the secretary will call the roll.
Yes, I'll start with you, Commissioner Chow.
Present.
And Commissioner Guillermo.
Present.
Thank you. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda are the minutes of the March 5th, 2024 committee meeting.
So is there a motion for acceptance of the minutes?
I'll move.
Yeah, I would second, but I'd remove remote participation since it was on site.
Yes, sir. And there's been no request for remote public comment participation. Would anyone in the room like to make public comment on this item? All right, so all those in favor?
Aye.
And all those opposed. Thank you. The minutes are approved. Let's move on to item 3, the monthly contracts report.
Hi, good afternoon, everyone. We have 3 items in this month's monthly report. The first one is from Haluna Health, from CHEP, Community Health Equity and Promotion. We have a Haluna Health contract amendment with a current total not to exceed amount with contingency of $1,480,679, with a new proposed total contract not to exceed amount with contingency of $2,932,035, with a change in total contract amount of $1,451,356. The current contract term is January 1, 2019 to 5/31/24 for a total term of 5 years and 5 months, with a new term now ending 7/31/24 for a new term of 5 years and 7 months. Regarding recent questions we received, I just wanted to highlight that due to federal budget delays, the NOFO or Notice of Funding Opportunity from the CDC was delayed. So the CDC required that these services be extended an additional 2 months in all jurisdictions to sustain services until the new start date of 8/1/24 for the new CDC grant award. This unspent funding comes from several previous fiscal years, mostly during the COVID pandemic, and is applied across the entire final fiscal term and not just the additional 2 months of funding. In addition to sustaining staff and services, a large portion of the unspent dollars being carried forward, nearly $500,000, will be utilized to purchase a large amount of point of care testing kits and supplies for approximately 15 community-based testing clinics for HIV, Hep C, and STIs. These sites include the DPH Public Health Lab, Whole Person Integrated Care, and many community partners. Additionally, with the recent reduction of about 7% in the CDC grant funding, the carry forward of these unspent grant dollars will allow CHEP to stockpile testing kits and supplies for future years to help offset these reductions a bit. While reductions in grant funding are not positive news, this is not a punitive funding reduction, but one that reflects the lower rates of new HIV infections due to the good work of CHEP and their network of community partners. We should have Nicole Trainer, the Budget Contract and Communications Manager for CHEP, who is attending virtually and can elaborate further and answer any questions you may have.
Commissioner, questions?
Yeah, you may have answered these questions in the email, I guess, sent or in the papers, but just so that I can clarify. So the 2 months extension was to give time to sort of work out all of the contract details and then to move it and then to do the carry forward?
To bridge the funding because of the delay in the new CDC grant award, which was delayed until
August
1.
1st. Okay.
Yeah, so the additional funding wasn't just for the 2 years, but was being carried forward for the entire final fiscal year and the final 2 months that were recently added because of the delay in budget and the delay of the grant award. Nicole's here to elaborate further or add any additional information if that's helpful.
Thank you. So that means there are unspent funds that will be carried forward to.
Yeah, the unspent funds were from previous fiscal years, mostly during the COVID pandemic, and a lot of it, I believe, from salary savings during the pandemic. But this allows us to spend that funding to bridge that gap in funding until the new grant starts and to stockpile some of these testing kits and supplies that we can use in future years.
And then the new contract or federal funding starts August 1st this year. And for how long is that funding?
I have Nicole here to answer the question.
Sure. It's great. Thank you so much, Dean, for that information and providing it. Yes, for the new CDC grant cycle, it's a new 5-year cycle. And so because the CDC funding is delayed this fiscal year, it will start on August 1st, but moving forward, the calendar year for CDC will start on June 1st of 2025, all the way through May 31st of 2025.
Okay, great. Thank you.
Sure.
So this is really an extension of only the 2 months because of the delay in the federal review and granting of new funding. Is that?
Right. But again, the funding is available for the entire final fiscal year, not just those 2 months. So
Right.
for a year plus. Yeah.
Well, we had previously passed that, right?
Yes.
So the request here is actually for the additional 2 months.
Correct.
All right. And let's see, I think that's all. I'm really pleased that we had a clarification for that because it seemed sort of odd. And so it's a federal government delay time. That's very interesting.
Yeah, for the systems of care that rely on federal grants, it's not a new situation, unfortunately, as I remember from my days at HHS.
Okay.
Sorry, I do have one more question. So
Sure, go ahead.
if it's for that whole final year, does that mean that costs that were incurred for that final year that weren't paid for prior to the release of these funds can be reimbursed? Or I'm not sure what it means to have that funding applied to not just the last 2 months, but to the final year.
Nicole, can you elaborate further on that question and how it's applied to the final fiscal year prior to the additional 2 months?
Yes. So our contracts are essentially cost reimbursement. So you're correct. So there's currently funding and contracts where work is being done. And so once this particular 1.4 million is approved, invoice templates will be released. And so billing will be able to occur during that time.
So does that mean that Haluna Health didn't have the funds for expenses that they were incurring because we didn't have the funds weren't released from the federal government, and so they had to cover that? Or were we providing advance funds? I'm just sort of wondering, for an organization to not have funds for a year for services they were providing because the feds were delayed, what did we do to?
Well, they had funding, but at a lower amount, and we've added funding, which allows them to provide additional services.
Mhm.
Additional services?
Nicole, can you elaborate a bit more on how they're, I mean, a large part of that, about 500,000 from when Nicole and I discussed earlier, is for the testing kits and supplies, and the remaining is for additional services related to expansion of some of the services.
Right, expansion, mainly continuation. So originally this grant, the CDC grant, was to end as of December of 2023. And so this grant was extended further throughout this 7 months because CDC didn't release the NOFO, and we didn't have additional guidance on when the NOFO was going to be released. And so we provided instruction that we could utilize our carry forward funds to ensure that we don't have any gap in services. Like you mentioned, that there won't be a time where agencies are occurring some of these expenses and they're not being able to bill for those particular services. But as Dean mentioned, a large portion of the funds and unspent funds that we do have are to prepare for the testing supplies and so forth, so that moving forward we don't have a gap in some of those particular services. We've already had funds added to those contracts through the base funding. So right now I'm trying to add these funds to this particular contract so we don't get into that situation that you just mentioned where they're having to front these funds and there's no payment being made.
Right.
Yeah.
Yeah. So that was really what my question was. Again, making sure that anybody that we contract with isn't sort of held responsible for
Right.
Expenses and costs that,
Right.
we're hoping to get reimbursed, but we never know when that NOFA is going to get released. And so they end up having to, if they don't have a reserve, I assume Luna has a reserve, but, it's still sort of a burden on organizations to have to cover that. So,
Absolutely.
Yeah.
Yeah. And
This is- Mhm.
Go ahead, Nicole. I'm sorry.
No, I was saying this is why we're here, to prevent that from happening. Yes. Yeah.
thank you.
Well, I could see what we're trying to do, but I'm trying to read the numbers to find out if this was an extension of 2 months and our current funding and approval was for May 31st of 24, right? And you're extending to July. And essentially, the 2 months delay, as you said, was related to the federal government really delaying by 2 months. But then I couldn't understand the difference that you're writing is that we have an annual difference of $1 million.
1.4.
And we now have a difference of 300%. So I'm not sure how those numbers relate to what we just talked about, which seemed very simple, which is essentially an extension of an already existing contract for 2 months.
I believe, and I'll let Nicole add further, but it's an extension, an expansion, and a purchase of those surplus supplies of testing kits for HIV, Hep C, and STI for the providers as well.
Yeah. So I think there's two things that are happening here that are a little confusing. There's the unspent funds, and then there's also the termination of this CDC grant cycle with the new grant cycle that's approaching in August 1st. And so when you go into a new grant cycle of 5 years, there's a delay in process for those new funds to also be entered into contract after we go through accept and expend. So what we do strategically wise is even with these funds, we want to make sure that we maintain services and there's no clear cutoff gap between the time that we're applying for this new NOFO, between the time that we are awarded and funds are in contract. So what we don't want to happen is that we have to end services simply because of the complexities of the process. And so, as Dean mentioned, what we've done is part of this unspent funds that we've had from the grants in previous years. We want to ensure that we could carry out the remainder of the services of this contract through July 31st, but also ensure that we can continue testing services, specifically testing services in the community, while the new hopefully we're awarded these CDC grant funds starting August 1st. Those testing services can still be continued and we don't have a disruption. So I think there's multiple things that are happening at the same time. It's really around sustainability of these services through June 31st and through the next fiscal year.
Oh, well, if these are surplus funds or unspent funds, then we're saying that they weren't covered in the initial contract that goes through 24, the 5-year contract that was already approved. See, I'm getting a little confused. If we, maybe it's because of the way the government accounts for money, so I don't know. But let's just say if we had a contract that was $1 million per year for 5 years, and are we? And now you're talking about surplus funds. So we didn't spend $1 million every year for 5 years, and we have $1 million left. I don't know if we're double counting, but it then sounds like if we're only adding 2 months and say that's $200,000, then the real addition is $200,000 to the original contract. Even though we might have $1 million left because we never spent the $1 million. And we're going to spend it in this period of time, but we didn't spend it when it was sort of allocated per year. So this sounds, from the way it reads, that we're adding money beyond the 2 months.
Nicole, was all this unspent dollars from this contract only, or was some from other CDC funded contracts, or did it all come from just this contract?
The
1.4.
Oh, no. So this particular unspent funding comes from the entire grant, like you mentioned, the grant cycle of through previous years of unspent funds. And like you said, we've allocated these funds across this particular contract to ensure that we sustain mainly around the testing services is where the gap, where we foresee the gap in services being possible, the gap in services existing within this particular contract.
Thank you. So this 1.4 million isn't just from this contract, but other CDC contracts, but you're putting it all here mostly to support the needs of the testing, to make sure that it continues in the interim, and for the accept and expend, and all the grant dollars are available at the beginning of the new CDC term on August 1st. And you've accumulated that from different CDC programs, added it to this one contract.
Exactly.
Okay. So that
Well,
makes
that makes some sense, but
Yeah.
that's not exactly the way it was reading. Or, I like your explanation before. We were just adding 2 months. But now you're saying the extra money is also coming from other parts of the grant that have not been expended, and it's going to be put into this program. And so therefore, the contract needs to reflect that, because this is a contract that's separate from the ones in which there are still funds unspent that are going to be put into this contract. Is that about right?
Correct. Yes.
Oh,
Sorry for the grant CDC funding and unspent funds can definitely be complex. So I apologize for the confusion.
okay. So again, I think like Mr. Goodwin says, this money is coming from other parts of the grant and other programs, and you're using that in order to enhance this particular program.
And to make sure that there's no gap. So that now makes sense, right?
Yes.
So, okay, yeah.
Okay, I know that's perhaps really hard to put in paper or into this format, but you can understand that as we're looking at this, we're only extending 2 months. All of a sudden, we have a huge $1 million that we're putting in here, which is more than 2 months. So, okay.
Yeah, exactly. Thank you, Nicole, and thank you for the questions because that provided us an opportunity to.
No,
provide-
thank you. And I think any of us were questioning the services that were being rendered here. And shall we move on to our next contract then, Commissioner? Okay.
Okay. Second item is.
Thanks, Nicole.
Second item is the Positive Resource Center contract from HIV Health Services. We have a Positive Resource Center contract, which is a new contract for continuing services awarded to the previous provider, previously approved by the Health Commission just recently on February 6th, 24. The new proposed total contract not to exceed amount with contingency is $5,476,794, with the proposed annual amount without contingency of $977,999, which is not a change from the prior annual amount or current annual amount without contingency in the contract that will end June 30th of 24. The new proposed contract term is July 1st, 2024 through June 30th, 2029, for a total of 5 years. Regarding the question asked of corrective actions in the future of audited financials, there was information that Michelle Ruggles helped to pull together with the BOCC fiscal team that we provided to you all through Mark earlier. Basically, we discussed this at a meeting, I believe, in January, recently, a couple months ago, in regard to the PRC and the fiscal report. And Wasim Samara from BOCC shared at the time that there would be a citywide fiscal and compliance team to review documents in April and May to update each of the items on that report, and that we plan to bring those results back to you and update you on that likely in July after Wasim is back from his leave. Wanted to share that with you, but you have more details there. And we have Beth Neary, Assistant Director of HIV Health Services, who is here to respond to the previously submitted question regarding the populations being served by the multiple programs in this contract and how they may be different or similar.
Hi, am I visible?
Yes.
Okay, well, thank you. So this contract, there was a question about why there are multiple contracts. The full contract, everything on here is a workforce development item, but there are some key differences. There are actually 5 budget appendices and 4 narrative appendices. The very historical background is the first traditional HIV workforce training was started by HIV Health Services, funded by HHS General Fund. Not in order of introduction, but in order logically. There's also a Getting to Zero add back from the Board of Supervisors that isn't on HIV Health Services budget, but serves substantially the same target population of people living with HIV, with a slight additional emphasis on people with additional STIs and a few other co-occurring factors. And then in addition, the other 2 major programs, On the Job Training and Lift Up, are both additionally Board of Supervisors add backs to support workforce development for a similar but not identical target population. Both On the Job Training and Lift Up aren't restricted. It's especially culturally competent for people living with HIV, but it could also be people who are at risk of HIV or just are in a very similar target population who are reentering the workforce. On the Job Training specifically, all members going through On the Job Training work with a subcontractor, Castro Country Club, to receive additional training. And then for Lift Up, some do also go through the Castro Country Club program for up to 90 days, but it's a little more focused on the PRC side of the workforce training. So they're substantially similar programs, but just slightly different tracks and slightly different limitations on target population. And I'm happy to take any follow-up questions on that.
If these are all similar populations, is there one core of employees who are doing this? And these are just sort of funding sources? And so if you come in from one of these different programs, you're really going to come into the same program? Because a lot of these read the same as you kind of read what they're doing. And so I'm just wondering, or do we have distinct employees in program A, B, C, and D, but they all do the same thing?
I don't know the complete answer to that, but the partial answer is that it is one cadre of employees at PRC who work together very closely and are managed by the same people. And there's some overlap in some of the people work in multiple programs, but not all. When they're talking about their program and their client participants, they keep them extremely distinguished in their minds for between the different programs. And at a time a year or two ago, they actually had sort of a little bit of an imbalance between the target populations and the number of people getting tracked into each program. And they actually had to do some work to retrack people into the programs that they were contracted to do. So I know that they do keep it pretty separate on their side, and their accounting for the clients is very separate. By the time of these most recent monitoring reports, they had retracked the clients. They were near 100% everywhere and not below. So I think that they do some work to internally realign their staff to match client demand. And then there's a little bit of feedback where they have to do that again if it doesn't quite match up on the first try.
Oh, and that's very helpful. Thank you very much. Yeah, I appreciate trying to understand how the programs work. But Commissioner?
So just a few questions. So
Mhm.
all of these different services that are part of this contract, how much of these services are funded solely by, or what's the percentage of these programs that are funded by the department versus, but the health department versus others, or are we the sole funder?
We're the major funder. There's one $40,000 ECN workforce add back. So one part of on-the-job training, $40,000 is funded by another department, and that's essentially because the Board of Ad Back, or the Board of Supervisors Ad Back, was placed on their budget. Everything else has been placed on the DPH budget that was a later add back because of our administration of this contract already, and that it is generally considered to be going fairly smoothly. So people usually track it here.
And would it make sense at all to combine these programs so that there is more uniformity? Or do they have to remain distinct? I mean, you talked about the imbalance and you talked about some of the overlap, and I don't know enough about the programs to understand what that really means, but do they have to be distinct? Since we are the majority funder, could we do something and it's coming from general fund, is there something that we can do to coordinate the funding a little bit more streamlined, or does that not work?
It is a possibility. We have discussed that with VRC because they recently won a new RFP when we tried to consolidate the services as much as possible. But it's actually the funding sources that keep them fairly separate. So 4 of the 5 have to be different because of the funding sources. Because there's HIV Health Services General Fund, CHEP General Fund from the Getting to Zero, and there's another HIV Health Services General Fund, but we want to keep that one separate because there's a piece that's not restricted to HIV positive clients, and that's very different for our unit. The rest of our funding is all specifically limited on target population to people who are HIV positive, so that's sort of our choice to keep that one separate. And then the work order needs to be separate. And we did ask PRC if they also were interested in simplifying where possible, if they would consolidate the on-the-job training and lift up, because they're fairly similar and they even have some overlap in subcontractor at this point. They consider those programs so differently identified in their program model that they didn't find that worth the administrative simplification on their side. So we're open to it, but we might have to start further back in the budget process to put things on the same budget.
And so that means then measuring the outcomes are quite different then. And so if we were looking at what the impact or the effectiveness of these programs are, then we would be getting different reports on the efficacy of each of these programs separately as opposed to all together.
There are right now 4 different monitoring reports coming out of this fairly similar set of programs. The only one that doesn't have two is, I believe it's Lift Up that just has a work order and regular funding. There could be some consolidation because the objectives are not identical, but they could be more similar. That's not maybe a limiting factor. Some of them focus more on workforce placement or education placement, and some of them, focus on slightly different metrics. But we can update those annually.
And when would we be getting those reports, or do we get those reports?
Generally, most of these are on the general fund fiscal year. Actually, I think all of them are on the general fund fiscal year. So they start doing those monitoring reports roughly in September, and we generally have them for the whole set by around the end of December. And I think I don't recall when the recent set went out, but we're actually reviewing this contract today. We just got it in our inbox. So it's not too late to make changes. But I think the monitoring cycle, we haven't actually posted our monitoring standards for this year either on the website just yet. We're going to in a matter of weeks. So that it's not too late to change it for this coming fiscal year if we had reason to or were requested to.
And do the past and current issues with the financial stability of the organization and some of the fiscal issues that are being monitored, how do they impact the ability for those reports to be completed, or the data to be collected and the reports to be sort of a cohesive report relative to the financial concerns that have been that are being monitored with Baker? So I'm just sort of, it's
Right.
trying to marry the concerns around the complexity of the programs and services and their similarities but divergent sort of objectives. Well, I wouldn't say divergent, but they're similar but not the same. And then also trying to, at the same time, assure that the stability of the organization is not impacting the delivery of those services that require, it seems, quite careful monitoring, right? Yeah.
Right. So there's a few parts. Of course, the fiscal stability of the agency is relevant to their ongoing ability to do this and to pay subcontractors. We haven't seen any signals of problems within this program from the fiscal stability, even as one of our other contracts several years ago was temporarily affected. This one never has been. And in terms of their ability to pull the data and be responsive to the monitoring reports, the Business Office of Contracts Compliance is incredibly thoughtful about how they set up this report, and they do all of these 4 programs at the same time. And they invite Bill Bloom and I or some of us from HIV Health Services to attend these monitorings. And this agency is especially good at presenting their data and presenting they bring in all the right people from each program to display and explain what happens and take questions from the system of care. It doesn't appear, it's BOCC monitorings are a lot of work, but they do have a person who's specifically identified to do their data who comes to those monitorings too. And it doesn't appear that this is a stressor on their agency, even though it is a little bit of extra reporting.
It looks like Ms. Ruggles has some.
Yeah, I appreciate the answers. I'm just trying to now internalize all of that and sort of line it up with my own, sort of lack of knowledge and background and, yeah.
So Michelle Ruggles, Department of Public Health Business Office. I wanted to, that's a great question because it is complicated, and we have vendors that have contracts across different sections, and within the contracts, there's multiple programs, as you heard, and that's what you're trying to assimilate. Those programs in the performance monitoring are monitored individually, right? Program by program. The agency receives the fiscal and compliance monitoring annually. That's what you commented on about the audited financial statement. And then DPH does a review and tracking of different variables within the audited financial statements. So there's a lot of pieces. And then if there's a corrective action plan, and it's a lot to keep together. So one of the things that we've done recently, I think I presented on to whomever was here about actually a year ago, we created a document called the Agency Financial Stability something plan. I'm just blanking on the name, but what the report is designed to do is to put in one place the full picture of the agency. And so that's how we've been trying to pull together, and like including PRC, when you have, because it's hard to look at that. It's hard to look at, oh, you had a monitoring finding in one program versus the agency's financial. So the way that this report is put together is it collects everything about the agency, all their fund tracks, the summary of their audited financial statements, any findings, if there's a corrective action plan or technical assistance. So it all goes into one single report. And the other, and yay, finally staffed, that we're going to be starting is a monthly meeting of DPH staff that share a vendor, identifying the vendors that have something going on. Like this would be one that we'd want to keep an eye on, that we would come together to discuss together that report and highlight any things that may have, like emergent issues that come up. There's flags that come up during the year that give us clues in general that maybe there's a problem, like there's a lot of staff turnover, the director's gone, the CFO's gone, or if they owe us back money and they want us to recalculate the repayment. So there's a lot of flags. In addition, the monitors are going out for the annual. So we try to pull all those pieces together in this format to look at the agency as a whole so that those pieces of information are overlapping. And certainly if someone's on a corrective action plan, those pieces of information are all overlapping, fiscal and performance.
So in that report, is there an alignment that's possible between, even though it's for the whole agency, between the financial or the budgets for particular programs or their contracts and the performance and outcomes, programmatic outcomes, or is that a separate thing?
That's part of it, because the
Okay.
performance monitoring, they look at 4 things every year. And the outcome of the performance objectives is one of them. So it lists out the objectives, like what did they get? And so if somebody got a 1, then, right, that's a flag. So that's what we want to highlight. Because the way it works now, it's hard for a program manager owner to own all these pieces and assimilate them because they're coming through different DocuSigns at different times, and we're a huge department. So that's what this goal is. It gives all the, like, for example, you saw one of the letter that came out of the fiscal and compliance monitoring, and it said like finding and send in your response October 20th or something. So that type of information would go into the report to say, look, here's what happened with this year's, with fiscal year 21, 22 audited financial statements. So so the rest of the piece of that, we've identified, through different factors, like 14, I think, or 12 agencies that we wanted to like make sure we had a robust report ongoing, and then that will be the basis for the meetings that we're planning to start up monthly to, talk about those and make sure we don't miss any flags.
So then that goes beyond, we get, at the meetings, we'll get the monitoring report or the scoring, right? And whether the agencies have done their surveys or, and so on. And so there's an expansion of that. Is that, or is there some?
So probably 2 things. One, there's a report that backs that. So there's a report that what we just call the monitoring report, the annual monitoring report for each program. And it's scored, overall score, and then the 4 categories have a score. And so I'm not sure what you received, but so if you have something that has the categories and, points,
Yeah.
that has an actual monitoring report that you're definitely, that can be part of what goes to you instead of in a summary form. And you can see what the objectives are. And you can see, like, there's more detail because it goes into what they scored.
Yeah, and I think so that's great to hear. And, it is responsive to some of the questions that we've been asking, over the last, couple of years. And I think part of it is understanding, and I know when you make your presentation this year, we're going to get, sort of more detail around that. But I think part of that is understanding then how does all that data get sort of summarized and, presented. I think part of it is how the information is presented and then making that understandable and all the way down through sort of, to the point where we are either approving a contract, right? And sometimes in arrears, right? And then trying to reconcile that with both the funding mechanisms, the programmatic services that are being described, whether an organization has multiple contracts and then multiple programs within those contracts. So all of those kinds of things, right, are important to know. I don't think we need to have all of that detail, but it's at some point we need to just understand that flow, I think. Yeah.
Yeah. Well, definitely in the meantime, or waiting, I can send you what that form looks like, the report, and you can see what's collected and what's inserted. But yeah.
Sorry to take so much time, but it's just, this is an opportunity to, I think, using this one, in particular as sort of a basis to get a bit of more understanding. And I really appreciate, there's obviously a lot more that goes into it than what we see and that you obviously know and process through. And it's now, really just trying to account for all of that, those steps and that.
If I could just add, because just to close the loop on and it's in the summary, but we sent out, the city does their fiscal and compliance monitoring. And that's a process that's set up by the controller's office where all the participating departments form a team and go out, right? So they've done that for PRC. And so what you saw was the letter, you saw the first letter that said, you're not you didn't meet the target. So what's your plan? So they did actually provide the plan, and that was due October 20th, and they provided it October 11th. So they did, and they had explanations for what they were doing and what was, it appeared to me, non-fiscal person, everything was going in the right track. But, and then the letter, they did a final status letter, which you now have two, which reissued the original one, incorporated their comment and changed due date to status. So not in conformance for those 4 categories. And then what Dean said is then their 22-23 audited financial statement is due at the end of March. And there's going to be another citywide audit or fiscal and compliance monitoring follow-up in April or May, which will be looking exactly at, did those variables get better? Did the plan come through?
Do we know, since it's already April, do we know then that audit was completed in March?
I don't know if it was, and our person is in Jordan right now that
Okay.
did.
Uh-huh.
So that's a great question. I can find that out, but I don't.
If you could update us on that. Yeah. Okay.
Sure.
I do think this was a chance to really review what your process is, and thank you very much. Yeah. And I want to also thank Mark for having worked on the contracts report and bringing together the programmatic reports that we do have, because that's how it was helpful to understand that many of the services were the same, but that they were also very well done. And so that was very helpful. We didn't have to wonder, okay, are we funding something that is a failure and needs a lot more help, or are we funding something that's really terrific? And the services they're rendering,
Right.
I mean, they're all 4s across, and they have also given us, and that was very interesting, I thought, understanding not just the findings, but also what the clients and so forth. So that really helped us picture what the program was. And that's why we could ask you a new set of questions, which were probably much more pertinent than starting with, well, what do they do? And so that was very helpful. And I want to thank you for creating that.
Sure. Well, I want to give, all I did is an extra review. I was another pair of eyes on the draft report. Everything else has been provided by Mr. Goodwin and the business office. So I don't want to take credit for anything other than I had eyes and I made a couple of suggestions or comments or questions on the.
Because that was a good way to merge both where the program was, and then we've now gotten a very thorough understanding of where the financial
Right.
and contractual obligations are being looked at and monitored. And you've now filled in that you've created now a group that is going to be looking on a monthly basis at some of your most high-risk groups, right? And so that's really helpful today in trying to understand how we're going to do that. So, and so thank you very much. As kind of a follow-up to what we were, given last time and what was being presented to the Board of Supervisors, and I didn't see anything in the papers, which when something was presented to the board several months ago, it was, almost I think it was front page, in fact. So what has happened to that proposal at the Board of Supervisors that was to help resolve the Baker Place issue of PRC?
I did not go, and Drew Morrell is he's off this week, and I was going to ask that question, but I believe it was approved. And so, and I think all the credit goes to Drew and staff to pull all of those pieces together. But we can certainly, I know it was approved, but I don't know beyond that to be able to comment.
Oh, okay.
I'm happy to get the report. With that, would you like the report?
Well, I think I'd be happy to understand, because I think it's interesting. It's front page news when we have a problem. When we actually have a solution, we don't read about it. We don't find it. So that's where the good work that everybody then does to bring this back. And
Mr. Chow, can I just, there was at least one of the supervisors said that they thought that things were on the right track
good.
in response to the hearing. So there was some positive response to the work that the team at DPH, including the people here and Drew at the board.
Good. No, I thought that was very creative, and seeing the work that they're doing here too. I think we will hope that we'll get a report of what you find in terms of the audit.
Just one final comment on this. What I think is really important, as we ask these questions and sort of dig in is, it's really important for the public to know that the vast majority of services that are provided are funded by the department, and the contractors and the vendors that are executing on those are really doing the job, and are doing the job well and right. There are those few, but the few that are, have issues, it's important for the public to know that you're on top of it, right? And you are, but because there's so much that happens, behind the scenes, right? It doesn't surface and it's not visible. And I think that some of the questions that we ask is so that that can be a little bit more visible, and we can defend the work that is being done here in the department to the public, as well as really have confidence that the nonprofits and the other vendors that, that are executing, that are on the ground, are stable, have the support that they need, are funded, in a timely way. And as, in the previous thing, there isn't any gaps, right? And so that's really important. Not just because you're doing the hard work to make that happen, but that people know and appreciate that. And when there is a question, the question is either readily answered or can be answered, through the processes that you have in place. And I think that that's, sort of the question, the reason for the questioning is to bring all of that. And then the big thing is how does that funding and the programmatic, outcomes and the effectiveness of the programs really sort of come together, right? Because I think that again, it's a lot of money, right? And a lot of people that are affected. And so we just want to make sure that, that those don't sort of they're not in, sort of separate areas of monitoring compliance and, and procedures, I guess. So that's really what a lot of this is, right? So.
Thank you very much. And I thought the conversation added greatly to our knowledge. So that was very helpful. We'll go on to the next
Yep.
contract.
The third and final item on the report is with the University of California, San Francisco Ward 86. From CHEP, we have a UCSF Ward 86 contract, which is a new contract, again, for continuing services awarded to a previous provider, previously approved by the Health Commission on June 3rd, 2023. The new proposed total contract not to exceed amount with contingency is $8,387,577, with a proposed annual amount without contingency of $1,872,227, which is an increase of $382,176 from the prior annual amount without contingency of $1,490,051 in the current contract, which ends 6/30 of 2024. The new proposed contract term is July 1, 2024 through June 30th of 2028 for a total, for a total of 4 years. To respond to the recently submitted question regarding the increase in funding of $382,176. This funding is for STD rapid services provided at Ward 86, which were previously provided in a separate CHEP contract, but are now being combined into this new contract with other similar services being provided at Ward 86. So that's the increase. That amount comes from another contract. Again, we have Nicole Trainer, Budget Contracting Communications Manager for CHEP, who can elaborate further or answer any other program questions you may have.
Commissioner?
No, just glad to see that there was some alignment then of the funding for, yeah.
It's nice to see the amounts. Yeah.
Okay, so I have no other questions on this. Thank you very much.
Great. So please consider a motion to recommend that the full commission approve these contracts.
I move recommendation to approval.
I would second that.
Great. And all in favor?
Aye.
Thank you. Item 4 is a request for approval of a new professional service agreement with the Regents of University of California. And I believe Ms. Brown is.
Hello, commissioners. Hi, I'm Jessica Brown. I'm the director of the Office of Justice, Equity, Diversity, and Inclusion, also known as the Mental Health Services Act as well. And we're here to present to you a new solicitation for our UCSF Embrace contract, which focuses on providing pre and postnatal mental health services for birthing people throughout San Francisco. And so we wanted to give you all, there were some questions regarding the contract amount. The first answer for the current year is that the contract amount will be $1.3 million, and that is including a add back funding of $327,000 that came from the Board of Supervisors, particularly as a community advocate with Mega Black, who wanted to have more prenatal services for birthing people throughout San Francisco. So that funding has been added to the contract. We have about $1 million in the first year, which includes startup funding, also a prorated amount because of the contract start date had to be pushed back due to restarting the process. So we have on the current document, it has March 1st as the current contract start date. The original start date was in November of 2023, which would show an 8-month prorated amount of the $1 million. So the ongoing funding for the contract, though, will be $1.5 million each year. This would also include, this will not include the add back funding. So the other years outside of the current start year would be $1.5 million ongoing. There is a 12% contingency that's not applied to year one. And that's because of, again, this year is almost over as well. So what you're seeing on that contract form is going to be the startup years in the first year, and then ongoing to be $1.5 million. There was other questions too about this contract, as we all talked about back in February. The overall contract has been awarded to 4 different CBOs, RAMS, Homeless Children Network, Rafiki, and also UCSF Embrace. While they all are serving Black African American birthing people, they all provide different unique services. So for this contract with UCSF Embrace, they are serving clients that are tied to their medical system and also non-UCSF clients. Whereas RAMS is serving clients that were mostly referred to by surrounding clinics around the area, while also partnering with UCSF to receive any clients that will be triaged to RAMS based off of their location and their need. So all of the 4 CBOs are working closely together, will be working closely together. And in addition to UCSF, the Embrace program, this is their kind of framework. They've been able to successfully have this program for a while now, and that we've been able to be partnered with them. So they would be setting the framework for all of the other CBOs and providing also best practices and support as well. I think those were the 2 questions, unless we have any more.
I just had a general, because when there's an add back from the board, where does that funding come from?
The local fund, so, and it was COVID funding. So in 2021, we had a community advocacy group, Mega Black, that received some add back dollars from the Board of Supervisors to address community needs. One of those community needs happened to be more in maternal health. And so as a part of that, the Board of Supervisors allowed us to use about $1.2 million to allocate to existing contracts to provide maternal mental health support. So UCSF, RAMS, and Rafiki were the original pilot existing contracts until we actually developed the actual solicitation to expand the program. So we use Mental Health Services Act dollars to actually have an ongoing program, and we ended up awarding all 3 of those CBOs, plus the additional one of Homeless Children's Network.
Thank you.
So thank you for the response in regards to how these worked with other agencies. Could you also describe perhaps how this worked with the ZSFG program that we heard at the ZSFG JCC several weeks ago? Because I mean, it's great. You said these sort of have different doors that the constituencies have. So I wanted to know how this would work either in conjunction, or is that just another door?
It would be in conjunction with more specialty behavioral health services. So one of the reasons for developing the solicitation to have it go long term is that in ZFG we were seeing clients that were postpartum, pre and postpartum, that needed severe specialty mental health services. So the goal would be to have that warm handoff, warm transfer, which is why we would have a referral tracking system to see where our CBOs would be supporting some of maybe the lower to mid threshold services, and also referring them to some of our specialty mental health services if needed.
Okay.
So that's how we would be working together.
Right. And is there a formal process in which all these work together in terms of maybe coming together once in a while to talk about their, successes, findings, and share experiences?
Yeah, so during the contract negotiation meetings, we set up time to have monthly meetings and quarterly meetings with all of the CBOs together to talk about best practices. However, and in addition to that, because the 3 programs, RAMS, Rafiki, and UCSF have previously worked together, they're continuing that partnership. So so for example, RAMS is having some pregnancy pop-up villages that Rafiki has hosted. UCSF and RAMS work together on that triage referral system that I mentioned, on referring clients to either UCSF or RAMS. And so they're all connected to each other. And then we will be bringing in Homeless Children's Network to also offer that support and best practices in quarterly meetings.
Oh, very good. That certainly sounds like a coordinated effort in regards to the population. So, and thank you for clarifying the annual amounts that are being spent here, because that is helpful, because otherwise it looked like the annual amount, it was exceeding the contract.
Yeah. And we put in the 4 months, but it's going to be for that was previously the original amount was going to be $1 million for 8 months and startup period. But because we've had to kind of start the approval process over again to get city attorney's approval, that's why you're seeing the 4 months.
Okay,
Yeah.
sure. Any other questions? So we're in a position to move this to the commission for their approval? And I would second that.
All those in favor?
Aye.
All right. Thank you so much, Ms. Brown.
Thank you.
Thank you.
So commissioners, we can move on to item 5, emerging issues.
Well, I guess we've already spoken about the one issue in the room in terms of our fiscal situation. So we'll continue to monitor that. And would also say that as we're looking at all these contracts, that's also part of the lens. I think that the committee wants to be able to be sure that the amounts that are being spent are spent well, and to encourage coordination and eliminate duplication, if that's what it is. So would that make some sense?
Yes, thank you.
Okay.
Okay. And then we can move on to item 6, which is public comment. And I see no one in the room who's not staff or here for a contract. So now you may consider a motion for adjournment.
Move to adjourn?
And I'll second that.
All those in favor?
Aye.
All right. Thank you, everyone. Give me 30 seconds to turn everything off. Thank you. Thanks, everyone.